Vitiligo is, I call the Michael Jackson effect, where your skin pigmentation starts to turn. But when you start to see your skin pigmentation changing in a gross way, like in vitiligo or albinos, you're going to go to the pituitary gland always. So the pituitary gland, if we didn't have the blessed iridology, we would struggle to understand the connection between the gut tissue and the brain, particularly the transverse colon. So when you look at this and look at vitiligo or any condition that comes from the head up, generally you'll find a lot of lymphatic problems. Genetics in pituitaries always come out of the transverse colon, so when you see pituitary problems, you also see colon problems, GI tract problems, sinus problems. So you have to kind of clean everything down below to get the head to drain. Definitely a couple of things you want to think about when you have vitiligo, and that is you've got to think just like everybody else. First of all, I've got to get my body alkalized, I've got to get my body hydrated, I've got to get this lymph system filtering through my kidneys, I got to get all the congestion out of my sinuses, out of my bronchs, out of the walls of the bowels. I want to get digestion, I want to get absorption, I want to get utilization, endocrine glands, and I want to make sure I'm moving my digestive waste through my colon right, and I want to make sure that I'm moving my cellular waste through my skin and kidneys appropriately. That's essential before you can say, I've got vitiligo and I need to change this. And you notice that when we start working on people's pituitary glands, the vitiligo goes away. Simultaneously, you know we're always doing lymphatic work. Because when you say what suppresses or what augments function of cells, whether it's pituitary, thyroid, or whatever, you're always going to mostly go to the lymph system. Now, you got trauma involved in cases, absolutely. But even in a genetic past, who weakens these tissues and how do you weaken a cell? When you understand that only two fluids basically surround a cell, then yes, chemistry is at the forefront of life here. And then she went into hypothyroid at age 31. So look at this. The pituitary's down, and it takes the thyroid down with it, probably taking her parathyroid down with it too, and it just keeps taking, probably her ovaries are next, keeps taking everything down because it controls everything. I have vitiligo, and sometimes I just want to give this up because I just feel I cannot do this diet. Please tell me if there is any alternative. Now, with vitiligo, dear, I do want you to hit your pituitary gland. That is essential. Or you can't, just the diet alone won't deal with that unless you can get your pituitary healthy with just diet. Now, also, I want you to think about your transverse colon. I want you to think about your bowels and clean up your GI tract. Remember at the class we showed you how the transverse colon is always related to head things? So you know when you have a vitiligo case, you know that's pituitary gland, skin pigmentation issues, but you also know that she has to be backed up in that, and then also the transverse colon is that issue. So this is something you really want to focus on, is clean up that gut, because it's not just a vitiligo, it's what can happen as time goes on with these types of bowels and things that produce weak pituitaries. So go after that pituitary with a glandular for sure. You'll have to just time let the skin pigmentation change and work on you, but work on that pituitary. Be interesting if her monthly cycles are irregular too, because that's what you would also have a tendency to see with vitiligo, would be a female's menses off, since the pituitary controls the ovarian cycle. So you would tend to correlate a few of those things with pituitary for sure. She's desperate because the doctors say that vitiligo is for life. Vitiligo is not for life. I saw all videos and I couldn't find the video about vitiligo. Well, Chris is supposed to write that up. I've done probably 3 or 4 on vitiligo. So clean up the guts, clean up the kidneys, get the adrenals on, start moving lymph, get up here in upper circ, brain and nerve, and then take a pituitary, a glandular, and you'll see your mom's vitiligo starting to change. Take her some time, but it'll turn there, my man. The pituitary is involved. It can be genetically weakened in a genetic past, no question. But on the other hand, you have to assume lymphatic. And remember, we talked a lot about, we tried to show you on those eyes there, that when you talk about pituitary, you must always look at the transverse colon. You've got to clean up the bowels to effectively drain the head. It's just, this head just sits right down on top of your intestines, basically. So you really need to clean this whole area. And again, getting the kidneys going. And you'd want that, though. And thinking about this and going after health issues, you would want to do like anything else, spring clean. If you vacuum your car out, you just don't vacuum the front passenger side. You vacuum the whole thing. And that's the thing. You don't just wash one fender, you wash the whole car. So I like the fact that people are understanding that you have to do a systemic cleansing because this fluid is systemic. And you can't just do a couple of weeks and think, oh, I got it. There's just no such thing like that. That's just peeking around the door. You got to plan on months or take a year or two out of your life. But once you start feeling better and better and better, it's self-motivating. I have a granddaughter, 4 years old, that has vitiligo under her eyebrows and would like to know if you have a treatment for that. Please reply. I would appreciate it. Well, first, when you start to see vitiligo and then that skin pigmentation changes, you know the pituitary gland affects that. The other things you might watch in this 4-year-old is growth factors. Female side of that could have menses problems in the future, female problems. I mean, it's an untold amount of things that the pituitary can actually affect because it's the head of the corporation, so to speak. It's kind of the boss man. No matter what you're working on, I think it's important that you always start with the kidneys and adrenals, the lymphatic system, and the GI tract, the Fab Four. This is a time where I'd probably, since this girl or this individual is only 4 years old, I would probably use the endocrine gland formula. So I would probably use, if it was my child, I would use a kidney formula. I would use an endocrine gland formula. I'd probably do a few drops of the lymph system in a formula, 1 or 2 drops for that child. Definitely 4 years old, no milky, no cheesy, no nothing like that, because that clogs the sinuses with mucus and then suppresses the function of the brain and pituitary and pineal and blah, 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 blah. Sits up irritation of the nervous system and you have a child that's nervous and all this kind of stuff like that. You know, vitiligo takes a long time to correct. But I've had people already comment. I had one girl in just a few months, a young girl with vitiligo, say, look, it's disappearing. So that was good. That was good to see that, you know.